Hey listeners, our Health Highlights series continues with 3 more leaders who spoke to us at the health conference in Las Vegas. We asked leaders how they're seeing the consumer point of view being incorporated to bridge the gap between traditional sick care and consumer-based well care. Today's episode focuses on nutrition and sleep. So you'll hear from Jim Kirby, Chief Commercial Officer at Kroger Health, Dr. Christina Valentine, Chief Medical Officer at Kate Farms, and Dr. Carlos Nunez, Chief Medical Officer at Resmed. Let's get into it.
All right, I want to give you your name and title and whatever else you'd like to share about yourself.
Nice to meet you, Jared. I'm Jim Kirby. I'm the Chief Commercial Officer for Kroger Health. I'm a pharmacist by training and worked for Kroger most of my career, but I also did work in the hospital. I worked in the mail sector. I've worked for a PBM, and I worked for specialty pharmacy, but always in the pharmacy healthcare environment.
What are you spending your time these days just kind of focusing on and paying attention to?
Well, we're here at the health conference, and you can look around and there's nothing but AI, and AI. So, I mean, we have to pay attention to AI, but I don't want to get lost in it because that's an enabling technology that is going to be incredibly useful and transformative. But there's also things that we need to pay attention to that's right in front of us today, and that's GLP-1s are certainly would be an immediate answer that I pay attention to. I pay attention to the trends in primary care, what's going on there, what's working, what's not. I pay attention to CMS and CMMI and what innovation is coming from the government. I pay attention to MAHA and all the things that are coming and changing, and curveballs are being thrown at us all the time. So there is no shortage of things to lose sleep over now, Jared.
Way to put it. Yeah, I totally agree too. And I think even just focusing on one area that kind of changes the conversation or at least sets it up is where does the health consumer fit into all of this, right? Like when you think about their point of view, and I say they, it's first person. I'm a health consumer. You're a health consumer, right? And so that even in of itself is an evolution of how we think about healthcare, preventive care, wellness, not all being on different sides of a universe, but all being related to a single person who's trying to live better, live healthier. How do you see the consumer point of view like being focused on in any of those areas?
You mean to suggest, Jared, that people should be involved in their own healthcare? I mean,
wild thought.
Radical thinking. People have been in prison for that kind of controversy. I think that's one of the things that healthcare has been missing for many years, and why we have the brokenness that we have today is that it's a sick care reactive system. It's a siloed system that I would argue is even getting more siloed because of the technology that's coming. People have multiple different ways to access care on their own time, that none of it's being coordinated, none of it's interoperable, or systems are talking to one another. But I think that the good news of all of that is that patients are demanding change. And that change, I think, is starting to see some of the systematic changes that we're noticing. You've got companies that are out there that offer direct-to-consumer access to drugs, lab testing, so then you could, find out if you're going to die tomorrow, or, what sort of vitamins and supplements that you may need to be taking. But you also have people that are seeking advanced care and advocating for themselves, second opinions. So I think this whole movement of consumerism is really, really powerful. And it's something that I, as a retailer and as a community health provider, being a pharmacist, yes, this is exactly what needs to be happening. And the pharmacy is a key connection point to that consumer to help them along their journey.
So where does Kroger Health fit into that equation specifically, things that are that you're working on recently, and how does that help a consumer along that journey you just described?
I would characterize it in 2 ways. So one, let's think about outside of the pharmacy, and let's talk about the total store. We have collaborated with the food health company to have a scoring system. So we have 90% of our items that have a food health score associated with it, 0 to 100, but also a 4-color scale to simplify the nutrition facts panel, so people can just very easily see what is healthy and what's not, and they can opt up to something better. So we present to them a product that may have 2 or 3 points that is just slightly better for them. So they don't have to make sense of all the ingredient string and understand this, that, or the other. They just have to see the colors or know that 80 is a higher score than a 60, and they can make better choices, because you can't really improve something that you can't measure. So we have to start with the measurement, right? And then we can measure and aggregate the purchases in their cart, and then we can trend that over time. And then we can associate that with healthcare utilization and costs for an employer or for a plan. So that's the way, front of the store, how we're trying to elevate or create a more positive food system. And you've got CPGs that are responding and they're reformulating and they're wanting to know, like, how can they incentivize people to buy their better for you product? Are they positioned against other brands in their category? So it's an incredibly powerful tool. Second, let's talk about inside the pharmacy. So we need to be viewing patients as more than just the prescriptions that they're presenting. So we need to be talking about social determinants of health, assessing them for food and nutrition insecurity, and then referring them to either nonprofit or community-based organizations or our dietitians or things that can help them. Like 80% of chronic condition can be positively affected by food. So the people with chronic conditions, guess where they're getting their prescriptions filled? The pharmacy. So it's the perfect place for us to educate them and refer them to programs, including how to shop healthy at Kroger.
I love that. All right, so that leads us up to kind of what Kroger Health is up to right now and announcing kind of the newsiest news. So what would you like to share with our listeners?
The newsiest news is that today we launched the advent of the Nourishing Change movement. And so it's a lot of things that what I just talked about, like let's have a common scoring system. So Kroger has 2,300 stores across 35 states and District of Columbia. But what if I had Hy-Vee? What if I had Ahold Delhaize USA? What if I had a network of independent pharmacies through CPESN? Now I start to have a very robust network that can aggregate data across one another. We can create interoperability, and we can go to payers with a completely different model that is focused on the patient and is focused on prevention and holistic care. So that Nourishing Change movement starts with those organizations I just named. That's going to be on the SteerCo. Then we're going to form an advisory council, and then there'll be work groups for food for health, for data interoperability, clinical payment systems, and professional developments that will be producing market reports and all sorts of digital activations, webinars throughout the year. And it'll culminate with the next Nourishing Change conference that's going to be hosted by Hy-Vee in Des Moines, June 2nd to the 4th.
Fantastic. And that's quite a vision of what's possible here and kind of what those next steps are going to lead to in terms of any individual consumer being able to more easily create the ecosystem around themselves and their own health and wellness.
Well, they talk about, meet the patient or meet the customer where they are. Where are they? They have to shop for food. They're in our store. So that is the perfect place to start. And if we get rid of these silos, break them down, leave our competition aside, and work together on the real problems that can transform this healthcare system into one that is focused on the consumer, that is where we need to be. That's what we need to be doing. And that's what Nourishing Change Movement hopes to accomplish.
Really appreciate your time, Jim. Thanks for giving us a vision of what's happening here and some things to be hopeful about.
It's a pleasure, Jared. I was a little nervous. I thought you were going to make me wrap this entire interview, but I'm good that we did not have to do that today.
I would just like to keep everyone on their toes.
That's
Thanks
right.
so much.
Thanks.
I'm Christina Valentine. I always use my middle initial. I am a physician and dietitian, and I'm currently the Chief Medical Officer at Cape Farms.
Okay, so tell us a little bit about what does that involve?
I'm so inspired throughout my journey with the families I serve. It became apparent that some of the nutritional opportunities they had were just not that plant-forward, preservative-free, wholesome, good for you. And at Cape Farms, I was hired to help support the science backing to all that wholesome nutrition. And working with them over the past 2 years now, it has been a testimony to the legacy of Cape Farms, which was inspired by a young girl failing to thrive on the current nutritionals available and having the go ahead of her parents to find a new way to make nutrition more healthy with less preservatives, all good things, all the amino acids you need to grow. And so I'm inspired with this and really proving the clinicals and the science behind it.
So this is one reason I actually wanted to speak with you is being able to blend these two worlds, the clinical world, the nutrition world. The thing that's in the middle is the consumer who is trying to navigate what that means when it's inevitable today. It's inevitable regardless of age. It's inevitable regardless of background, demographics, you name it. We're each going to see, if we haven't yet, those shortcomings in current health, wellness, nutrition, wellness, preventive offerings. And then we get stuck and we're like, is this the start of a journey or an end of a journey, right? Of like, how do I get to the health and wellness that I want? So with that being said, I understand like there's a lot going on with Cape Farms right now. Are there any announcements or news that you'd like to share to kind of kick us off?
Yes, I'm really excited. We were recently acquired by Danone, which is exciting because they have the same cultural fit where heart comes first, people come first, people centric to take them on the journey, like you were just saying. And it allows us to scale and it allows us to reach more folks. So I'm really excited to take this medical grade nutrition that really is under all the scrutiny of being truthful about your ingredients, making sure it's science backed, and bring it into everyday wellness for people that just want a little extra protein.
Tell me about your experience so far with the blending these backgrounds, the clinical background, the nutrition background. What gaps were you seeing when you first came on board in terms of backing that, providing the scientific background here, and ultimately helping someone make a choice of like what to do with their nutrition?
It's really my inspiration. I noticed as a physician and a dietitian, when I would need opportunities to give people extra nutrition support, I found that a lot of people had problems with taste, adherence. They had gastrointestinal problems with some of the formulations. And when I looked at what was the physiology, what was the science causing those problems, really deliberately making ingredients to design for those issues. So plant forward with peas, fiber, things they were missing as far as nutrients, and really putting it in a Tetra sustainable package that they could not have to drink it all in one setting. They could just close it and sip it through the day. It really became clear that that was missing. That was missing. And if people aren't going to drink it or they're not going to tolerate it, whatever you put in that concoction doesn't matter because they're not going to get it. Right? So that was the big missing adherence link that we found.
How is the clinical community in general able to help a consumer here, right? You know what I mean? Because I think one of the themes we're going to continue to share on this podcast is a health and wellness journey and approach, a strategy for anyone out there. Isn't just what they learn from the clinical community or just what they learn from however else they're getting information from other sites or from the internet or from ChatGPT or what they watch on social media. Ideally, they're getting the right information from both sides. It's clicking, it's making sense for them, and they feel comfortable and they trust the information they're given. That's a big vision. That's a big ask to happen. And that's where we hope we get. We're nowhere close to that right now, unfortunately.
Right.
How can the clinical community play a bigger part in that and helping somebody feel good about the choices that they're making when it comes to nutrition?
I think the digital capabilities are going to help a lot, and really trying to enable the clinicians to have partnerships along the way. For instance, with Cape Farms, we have a customer care service that truly is not just that one question, what do you need from me, but going along the patient journey with them, helping them with questions they have along the way, materials they might need, support that the clinicians might need. I think that's the future. And also, I was chatting earlier with folks on the panel in that here at the health conference, we really need to get in the game of a narrative that means something to people, that gives them information that they can make true informed choices. So as clinicians, we have to do a little better to get in the general narrative. Like, I appreciate this podcast so much that we can say to folks, here's some information. You're smart. You can take a look at it. Here's ingredients. I have patients challenge me. What's in this? What does this mean? Take that back to your clinician. Ask good questions, because there are, we know a lot of products out there, and they might have, oh, this is truly good for you kind of speed to their narrative. And we want to be able to have that honest conversation with consumers to say, yeah, here's what's in it. This is some information you could go by. Here's some science backing, and let us help you along your journey.
I think you're right. We can all help get in the game a little more and just start from wherever we are and kind of work towards the same end. And that's going to take us a long way. Personally, what trends are kind of in the middle of your radar screen right now?
Well, I believe there's a lot of buzz around the GLP-1 community. And it's not just for weight management, but it's being used now for diabetes and other diagnoses, that this is really helping. And as a clinician dietitian, I found, golly, some of these side effects they're seeing could really be disrupted earlier if we get to them so they can maintain their GLP-1, because we know like 8% stay on it because of their side effects. And so we recently innovated for that patient population, specifically looking at the side effects they were having, the nausea, the diarrhea, the GI distress, and saying, okay, maybe their pancreas is feeling a little sick. Let's have a better fat blend. They don't want to eat too much. Let's have some really cool nutrition packed in a smaller volume with lots of aminos, good fiber, and good nutritional micronutrition like vitamins and minerals, and only 160 calories, no sugar. And so listening to people, that's what I'm getting at. We listen to consumers. We listen to physicians on the side effects, and we innovated that. And I have to say, it's been really helpful for people thus far. So this is exciting. And then, as always, being the clinically minded group, we are always innovating and thinking about what physicians and patients need in the hospital, but also this everyday health for them at home.
Anything else we haven't mentioned yet? A message you'd love to share with our listeners about what's going on, or just what you're excited about, or what you're seeing here at Health? Just anything else we haven't discussed yet?
I think just to build on the digital opportunities and really ensuring that folks, if they do have questions, that they reach out to really look at Cape Farms. There's product portfolios for diabetes and renal, kids nutrition. I'm very excited. All my nieces and nephews are on it because we know there's picky eaters. There's people that just don't eat all the nutrition they can in a day. And we know half of us in the United States of America don't eat half the fiber we need. So really targeting gut health and any population you want to serve, just reach out. I'd be glad to answer any questions.
Dr. Valentine, thanks so much for joining us today.
Thank you so much. This was great.
With your name and title.
And do you need me to answer in rap?
Only if you'd like to.
Okay, because I could probably, I'm Dr. C and the place to be, helping you breathe and sleep efficiently. I don't know. Never mind.
There we go. I like it. Well, we might keep that in.
Oh, no, I should have done that.
All right, Dr. C. All right, give us full name and title, a little bit about yourself.
Dr. Carlos Nunez. Carlos Nunez. I'm the Chief Medical Officer at Resmed. I'm an anesthesiologist and intensivist and was in private practice, academic and then private practice for a while. But I'm also the nerdiest doctor on the planet, and I will fight anybody who tries to take the title from me. I literally build robots in my garage. I 3D print the parts. I write the code. So I've always been very techie.
Let's start with, what is Resmed kind of announcing here at Health? What's the latest news that you want to share with our listeners?
Sure. So let me tell you a little bit about Resmed, because Resmed may not be familiar to everyone unless you've got sleep apnea and you really love your CPAP machine. But Resmed is the world's leader in providing solutions for people who have sleeping, breathing, and other conditions that they manage in their home. Things like sleep apnea, respiratory insufficiency, etc. The company's been around for 36 years, and our largest line of business is CPAP therapy for sleep apnea, but as I mentioned, we do many other things. What's big for us this year and at Health, I think, is a couple of things. It is the convergence of lots and lots of technology in the healthcare space, getting closer and closer to the consumer, which is becoming ever more interesting to traditional med tech companies like Resmed used to be. And I say used to be is because Resmed, I think, is one of the most successful sort of traditional med device companies that's made this two-step pivot. You go from med device to med tech when you start to realize, okay, my devices are really important, but I need to knit them together with some software and platforms. And then you make that final step of the pivot from med tech to health tech or digital health, when you realize the software, the platforms, and more importantly, the data may be just as valuable as the devices. And so you start to build an ecosystem for your patients, for the providers who take care of them, for the people who aren't even yet patients, who need the awareness of the disease or the condition so they can become part of that ecosystem. So that's what's new, and it's all being driven by a few things. It's technology that generates lots and lots of data that is now being used by lots of companies in things like large language models and AI to make healthcare more efficient.
Okay, so just a little bit going on. In
just
other words,
a little.
Right. This convergence is really interesting, though, what you were just referring to of the evolution from med device to med tech to health tech. Where are you seeing things being designed or created or built around how a consumer actually experiences their health?
That's an excellent question, and I'll tell you why. In the American healthcare system, we are usually really, really good at all the little point solutions that deliver some high technological, amazing cure, amazing diagnostic. We're so good at that. But where we have difficulty is creating a patient experience that makes it easy to gain awareness, makes it easy to get screened and diagnosed if you have a disease or a condition, and makes it easy to get on therapy and understand the therapy and how to manage it for whatever period of time and maybe for the rest of your life. It's that patient pathway that is often what's broken, not the tech, not the drugs, not the devices. And Resmed, especially in sleep medicine, recognizes that it can be a particularly painful pathway. So using sleep apnea as the example, if you are suspected of having sleep apnea, in the United States, it is not uncommon to wait 2 to 3 months or even longer for a sleep lab visit. But not everybody who has sleep apnea needs to go to a sleep lab. It would be like sending everybody with hypertension to a cardiac cath. To get a cath from a cardiologist just to prove you've got hypertension, instead of, well, wait a minute, what if we do something simple like take your blood pressure with a blood pressure monitor and monitor it and then treat you for your hypertension. So similar, it's not completely analogous, but you can do more home sleep testing, get more patients seen, and then leave the sleep lab for those complicated cases that really need the full-blown in-lab diagnostic. So the most important thing that Resmed can do is make sure people understand sleep is important. It's a major driver of health. And if you have a sleep disorder, talk to your doctor. Then what's the next step? Well, when your doctor wants to get you diagnosed, you don't want to wait 3 months to go to sleep. This is so important. Why am I waiting 3 months for the diagnostic? You can take my blood pressure today or a blood test today. Send someone home with a sleep test. A home sleep test, you can't see it on the podcast, but the newest ones are tiny. They're the size of like a pulse oximeter. They sit on your fingertip and you can get diagnosed. But then beyond that, there has to be a pathway for the patient to then take that information, get on the therapy, get the support they need, get supplies, disposables, refills, whatever it takes. So how do you innovate there? Doesn't always feel very sexy. It's not always the highest tech parts of healthcare, but that's how you help people go from awareness that there's a problem to long-term successful therapy. So it's innovating on home sleep testing, innovating on business models, working with partners in the industry. We've got big tech like Apple and Samsung whose watches now detect sleep apnea. How do we make sure those patients end up getting the information they need and the on-ramp to the pathway that's not broken for them? Very heavy sleep apnea specific example, but I think there's a lot we can do. We have an amazing healthcare system. We spend lots and lots of money, but patients often get lost. How do we help them navigate the healthcare system? It should be as easy to navigate the healthcare system as it is to navigate the Amazon app.
Perfect analogy. And we're hearing it more these days with different aspects of the industry. Sleep apnea is a perfect example of one that is maybe the entry point into where somebody ends up having a very different conversation and they're touching base like in a different way, trying to navigate their own journey. So if you're speaking directly to that person, that yourself or family member or just somebody you come across who's very clearly struggling to navigate their existing options, how do you help them bridge that gap? How do you help them understand it without adding to the sense of overwhelm, the sense of lack of trust of what's available to them before? Because that's where we are right now. Like we are in the midst of like more options than ever before. I believe in the ability of so many new devices, new options to help people. And my experience has been when I share them, because, my goal is to spotlight as many as possible. And I share them with a family member and they're like, I don't know about that. Instead of like, how do we get to the point where they're like, oh yeah, I want to try that. Like that sounds like an option for me, instead of like they either don't trust it or they're just apathetic at this point because they've heard it before.
Yeah. No, it's difficult because there is so much information out there, and many people rely on social media as their primary source of information. And we know social media can often be filled with disinformation or misinformation, especially about health and wellness topics. There's a lot out there that gets thrown out without really good science, or even people just taking the time to look a little deeper and see if there's anything there to some of these claims. But these are really simple. I'm going back to the sleep apnea example, right? You have to breathe. You cannot suffocate multiple times an hour and think that that's good for you. Your brain needs oxygen. Your heart and your organs need oxygen. And yet someone with mild sleep apnea suffocates every 4 minutes, every hour while they sleep. That's considered mild. And so when you recognize there is a problem, there's two things that have to happen. One, people need to have some information so that they can ask the right questions. That's where people struggle, because we do have a confusing, difficult to navigate system. So at least understand the questions you should ask. And you know what? AI can help with that. I mean, you could talk to an AI chatbot. I can recommend one. There's one called Dawn. I mean, it's kind of a shameless plug. Resmed has a chatbot on their website. Dawn, like the dawn of a new day. And what Dawn is basically a chatbot that is tuned to sleep health. So you ask it questions. Why am I always tired? Why this? Why that? And of course, if you get too deep, Dawn is smart enough to say, you know what? These are the questions you need to ask your doctor. I'm not going to be able to help you any further than that. But it may be something simple. It may just be, oh gosh, I didn't realize I should turn off all the lights and have a quiet, environment and dark, quiet environment. Or it could be something more serious. So it's knowing to ask the right questions. But then there's the other side. In healthcare, we have to kind of get over ourselves a little bit. People are going to show up with things that they've learned on ChatGPT or Google. They're going to show up with the app from their Oura Ring or their Apple Watch and say, look what it shows. And we can't, as physicians, say, oh, that's not a diagnostic quality. It's something. And it's driving behavior in your patients. And you need to understand what it means to them, how to interpret it, and then do a little research. Because there are companies like Apple, Samsung, Oura, and others who do a lot of clinical research and take the time to get things cleared through the FDA so that they can be trusted. And so it's a coming together of the consumer and the medical industry in this interesting, messy health and wellness space to make the best of what's regulated, the best of what's coming from the consumer side, and use the insights from all of the data to drive better health, better awareness, and better outcomes.
Carlos, what haven't we shared yet that you'd like our listeners to know?
I think the most important thing, I've used the word sleep and sleep health a lot. Sleep is extremely important. Not even talking about sleep apnea, even though that's, we've talked about that a lot. There are 3 pillars to human health: sleep, nutrition, and physical activity. And we often focus way too much on diet and exercise. We're striving to find the latest trend, the latest this, what piece of equipment's going to help me run an extra couple seconds off my marathon time. And we will wear poor sleep like a badge of honor. Oh, I only slept 4 hours, but I'm fine. I double Starbucks espresso or whatever, and I'm good to go. Not realizing that every minute that we cheat our bodies and our brains of good, healthy sleep is time that we're taking away from our lives and our wellness. I heard someone say this recently: you can either spend time today on your wellness, or you'll spend that time later in your life on your illness. And things like preventive care, which I think you mentioned earlier, and even the types of conditions and comorbidities that you need to treat and keep under control to prevent even worse things like hypertension or sleep apnea, diabetes. These are all going to benefit because the technology in the consumer and the medtech space are coming together to make your lives easier, to give you the insights, to make it easier for you to navigate. Hopefully on the sleep and breathing side, it's Resmed that'll be on the forefront, but all the other companies here at Health are trying to do the same thing.
Carlos, thanks so much for joining us and giving us a lot to think about.
Oh, it's my pleasure. Thank you. This was great.